那就各位老师，Koocher 教授，早上好。首先呢，要感谢大家哈，在百忙之中啊，抽出这个时间来参加咱们这个小组的活动。这是第一个。第二个要感谢他呢，实际上我们这活动是Koocher 老师的Koocher 教授能够邀请到是严玉鹏老师，这个多方联络。而且呢，咱们这个做梦也是东方明鉴，就是给我们提供的支持哈，所以在这里要感谢严老师以及东方明鉴的支持。那第三呢，就是我们要隆重的来介绍一下Koocher教授啊。那Koocher教授呢是西蒙斯大学的荣誉院长，是哈佛大学精神病学的讲师。他被选为2006年度的 APA 的主席 ，APA 13个分会的会士，曾经担任 APA 4个分会，也就是临床心理学、儿科心理学、心理治疗、儿童青少年与家庭服务这个4个分会的主席。他是首位获得 AB、PP 5个专业领域，包括临床心理学、临床儿童青少年心理学、家庭心理学、法医心理学、健康心理学证书的心理学家。那么今天呢，就是 Koocher 教授呢是免费给咱们过来做。对，那他这个也是就是想为29分会，就是 APA 的29分会做点贡献。实际上就是咱们今天的这个培训也算是29分会的继续教育的项目。那我们还有继续教育的29分会的继续教育的学分啊。所以呢，在这里呢，就是真的是也代表我们专委会吧，代表咱们的这个专委会的这个行政项目，特别的感谢Koocher教授。好的，那辛苦瑞宁帮着翻译一下哈，大概翻译一下。
Okay, Dr. Koocher, Dr. Liu expressed his sincere grateful for you, and on behalf of our committee, and we want to thank you for your support for the evidence-based program in China. Yeah, and he also introduced your title. I will not translate that. Okay.
好的，那下面呢，我想我们的这个今天的活动呢，就不超过2个小时，咱们就到10点钟，最多到10点钟准时结束。那我们我估计呢，就是 Koocher 教授介绍完他的 PPT 以后，可能会留一点时间给我们再向他请教问题啊。那我就不浪费时间了，就现在把这个时间交给Koocher教授。
Okay, Dr. Koocher, maybe we will end at 10. I don't know what's the time in Boston.
In Boston, it's 7 p.m.
7 p.m. Okay, maybe
So
end at
9 p.m.
Yeah, and okay, and you can start your lecture for us.
Great. I'm honored to be invited to talk to you, and I'm going to try to give you a summary of how evidence-based practice began in the United States and the current status of it. And then I plan to allow time at the end for people to ask questions, if you have questions you would like to ask.
那我很荣幸能够来跟大家做交流。那我接下来将总结一下循证医学是如何在美国开始的，以及它现在的发展现状。那最后我会留一点时间给到大家提问。
So the reason that we pay such great attention to evidence-based practice is that many people have historically relied on experts or people in authority to tell them how to practice.
我们现在如此 重视循证实践的原因是，很多人会依赖专家的权威，告诉他们如何来做临床实践。
And relying on expert advice can sometimes prove ineffective for the 3 reasons I have listed here.
那依靠专家的经验，往往不是很有效。那我将从以下3个原因来解释。
Some clinicians, psychologists who are in practice, may not keep up to date with new research findings. Sometimes, oh, no, go ahead.
You can continue. OK， 那一些临床医生，可能跟不上最新的研究发现。
Some may have a personal or financial bias. For example, they may have written a book and want people to buy their book and to use their view of therapy.
那一些临床医生可能有个人或者经济方面的偏见，比如说他可能写了一本书，希望人们去买他的这本书，并且使用他的治疗观点。
And sometimes practitioners have their judgment clouded by what I call heuristic biases. And what happens when you have such biases is that you have ways of thinking that can lead you to make errors or mistakes in some cases.
那另一些临床医生的判断可能会受到启发式偏见的影响。当我们有这种偏见的时候，可能会产生某种错误或者偏差。
So this is how evidence-based practice really began. It began in Great Britain in the 1980s, and it's often attributed to a physician named Archie Cochrane.
那现代的 EBP 运动开始于20世纪80年代，我们通常认为它起源于一个叫做 Archie Cochrane 的医生。
I've given you the reference to his book, which came out in 1979 and was a critical review of medication that has been used, some of which was ineffective.
那我给你们提供了他的参考书目，这本书是出版于1979年，是对已经在使用的药物的一个批判性的评论。但其中一些可能是无效的。
Cochrane and his colleagues formed a group called the Cochrane Collaborative, and they began to collect evidence of medical treatments that were supported by randomized clinical trials, very sound research, as contrasted with treatments that are dictated by authority figures.
那科克伦协作组织就开始搜集由临床随机对照研究支持的医学治疗的证据。那这些都是做得很好的研究。
So the goal of evidence-based practice is to infuse our clinical work with the best scientific research so our patients can get the best research-supported treatment.
所以 EBP 的目标就是使用最好的科学研究，注入到我们的临床工作中，那让患者去接受到最好的研究支持性的治疗。
In the United States, many people have health insurance provided privately rather than from the government. And after Cochrane's work became popular, many insurance companies said that they would only pay for treatment that had an evidence base.
那在美国有一些人的保险是由私人的保险公司提供的，而不是由私人提供的，而不是政府。那从这个科克伦的研究之后，一些保险公司开始要求循证治疗的，开始要求它的治疗是循证干预。
I'd like to say a little bit about heuristic biases. Heuristics refer to mental rules that we adopt to help us cope with the world efficiently in our thinking.
接下来我将说一下启发式偏差。那启发式偏差是指我们以一些思维方式帮助我们更有效的应对世界的这样的心理规则。
We have 5 senses and are constantly getting data into our brains from all of our different senses. But we make unconscious decisions using mental rules that we have learned over the years to manage efficiently with all of the data that we are receiving.
我们有五感，并且我们的大脑通过不同的感官来获取数据。那我们会运用这个多年来接收到的心理规则，来帮助我们无意识的做出决定，然后帮助我们管理获取的信息。
Think about driving an automobile. When you're driving, you are watching the road, you're listening for sounds, you're feeling the movements of the car, all as you're driving down the road. But many times it seems automatic. You're not thinking about what you're doing, you're just doing it.
想一下你在开车的时候，我们会观察道路，会倾听周围的声音，感受汽车的运动。那我们很多时候其实是无意识进行的，你并没有思考你现在在做什么。
Just as some drivers become comfortable with driving in an automatic way, sometimes psychotherapists have become comfortable in certain ways of doing things and tend to do them automatically.
就像一些司机对这种无意识的驾驶感到很舒适一样，那有时候心理治疗师也会对这种做事的习惯做事的方式感到习惯，那倾向于自动化的去做治疗。
So these ways of thinking save us time, but may fail or we may make mistakes when data comes in that is beyond our normal experience.
那这样的思维方式会节省我们的时间，但也可能带来一些问题，或者我们可能会犯一些错误。
And we are often not consciously thinking about how we're making these decisions. We just make them because they feel right, or they feel good to us, or they feel comfortable to us.
我们经常无意识的做出一些决定，只是因为这些决定我们感觉是良好的，或者是感觉到舒服的。
Several years ago, I traveled to Japan to consult with the Japanese Psychological Association on establishing licenses for psychologists in Japan.
那几年前我去日本，和日本的心理学会去商定设立日本的心理学家执照的问题。
I asked about the most popular approaches to psychotherapy in Japan at the time. This was about 25 years ago. And I was told psychoanalysis was the most popular.
我问当时日本最流行的心理治疗流派是什么？大约是25年前。那我被告知精神分析是最流行的。
I asked why. That seemed very unusual. It didn't seem to me to be very well aligned with some of the ways that Japanese society operated. And they told me that at the end of World War II, the European and American psychiatrists who came to Japan told them this was the way to do therapy.
我问他们为什么会这样，那这和日本社会的运作方式也不太一样。那他们告诉我，二战结束的时候，有一些欧美的精神病学家、精神分析学家，到日本来告诉他们要这样去做治疗。
this is a very good example of the Japanese people in the 1950s and 1960s and early 1970s saying, well, the authority figures are telling us what's good, so let's do that.
这是一个非常典型的例子，就是在20世纪50年代、60年代、70年代初，有权威人士告诉日本人说要这样做治疗，他们就这样做了。
The problem is that one form of psychotherapy is often not the right treatment for every problem.
但问题是，心理治疗的某一种形式通常不是针对所有问题的最好的方法。
If a patient comes into your office and tells you they have anxiety about spiders, you might think of using a desensitization program.
如果一位患者来到你的治疗室说他有对于蜘蛛的恐惧，那你可能会考虑使用脱敏疗法。
But if they come into your office and say, help me, I'm not getting along with my parents, desensitization isn't what you want to do with them.
如果说他们来到这里说跟父母的关系不好，那脱敏可能就不是你需要做的。
You probably want an approach to family therapy or a more interpersonal approach to psychotherapy.
你可能更希望使用家庭治疗，或者是更为人际化的治疗方法。
So it becomes important to understand the problem and to find the evidence that shows you which treatment might be best for which mental health problem.
所以很重要的是先理解患者的问题，然后去寻找对应的证据，看哪一种治疗方法对于这种精神健康的问题疗效最好，这个就是很重要的。
Some examples of heuristic biases, with the ones I'm showing you are drawn from the work of Daniel Kahneman, who has a very nice book out called Thinking Fast and Slow.
那接下来是一些关于启发式偏差的例子。我举例的呢是来自卡尼曼的书，叫做《思考快与慢》。
Kahneman won the Nobel Prize in economics, even though he's a psychologist. He wrote about how human beings make decisions using different heuristics.
卡尼曼获得了经济学领域的诺贝尔奖。即使他是一个心理学家，他写了一些关于人类如何用不同的启发法来做决定的内容。
One example is confirmatory bias. That means you've made up your mind, you know what's best, and you then go to look for evidence, but you only look at the evidence that supports your hypothesis.
其中有一个例子就是确认偏误。这就意味着你已经下了决心，知道什么是最好的，然后去寻找相关的证据支持你的假设。
So if I want to do a psychological study and prove that women are crazy, I'll look for newspaper articles about women doing crazy things.
如果我想做一个关于女人都疯了的心理学研究，我就去报纸上寻找关于女人做疯狂的事情的文章。
I'll ignore women who do great achievements or become great leaders or great scientists. I'll ignore that.
我会忽视那些做出了很伟大的成绩，或者是成为厉害的领导或者科学家的事情。
We sometimes see this type of thinking in the police, who think they know somebody who committed a crime, and so they don't look at any evidence that might support the person's innocence.
那我们经常会在 执法过程中看到这样的问题，比如说警察认为一个罪犯犯了罪，他就会寻找相关的证据，而忽视那些他无罪的证据。
Another example is groupthink, meaning that individuals whose ideas are different from the rest of the group may keep their ideas to themselves, even if they're good ideas, because everybody else thinks the sky is green. I'm not going to say it's blue.
那另一个呢是群体思维，就是说在团体中，有的人会不表达自己的看法，即使他的看法是比较好的。比如说，大家都认为天空是绿色的，我不会说它是蓝色的。
So if my professors and my colleagues are saying this is the way to do psychotherapy, but I have some data that suggests that there might be another path for different kinds of patients, I may hide my beliefs because I feel as though I'm not part of the group.
如果我的教授和同事说这就是心理治疗的方法，那我即使有另一些数据表明有不同类型的病人可能需要另一种方法，但我也不会说我的看法，因为这会让我看起来不是团队中的一员。
Two more heuristic biases are the representativeness bias and the gambler's fallacy.
其他两个启发式偏差是代表性偏差和赌徒谬误。
So in the representativeness bias, we are making inferences or conclusions based on a prototype that we look at to represent a whole category while ignoring base rates.
代表性偏差是指我们推理的时候会用原型去代表整个类别，忽略基础的比率。
Suppose that you have some experience with criminals who always wear gray jackets.
设想一下，你对总是穿灰色夹克的罪犯有一些印象。
And you start to believe that everyone you see on the street with a gray jacket may be a criminal.
你开始相信每一个穿灰色夹克的人都是罪犯。
But you're misrepresenting what the normal base rate is.
但是这里你就误读了正常的比例。
Another one is the gambler's fallacy, meaning that people don't really understand random sequences or probability. So they're betting money and they're losing money, but they'll say, I'm going to keep betting because my luck has to turn around soon.
那另一个是赌徒谬误，也就是说人们不是真的理解随机序列或者是概率的问题，所以当他们输钱的时候，他们会说我要继续赌下去，因为我随时可能会赢。
You know, as psychologists, we study statistics and probability, so we know what a random event is. Still, some people believe that if they keep trying at something, even though it's random, their chances of winning will go up.
所以作为心理学家，我们研究统计和概率，所以我们知道什么是随机事件。有些人相信他们可以赢，但实际上，如果他们继续尝试某件事，即使是随机的概率，他们获胜的几率也会逐渐增加。
Another important thing to think about when selecting psychotherapies is the way humans make decisions.
另一个选择心理治疗时要考虑的重要问题是，人们做决定的方式。
Very smart people can manipulate 4 or 5 variables in their head at one time. The average person typically makes decisions based on only 2 to 3 factors.
聪明的人 做决定时能够操控4到5个相互作用的变量，但一般人只能考虑到2到3个对他们来说重要的变量。
I enjoy this when I listen to people in the United States tell me how they're going to vote in an election.
我很喜欢听美国人去讲他们如何在选举中投票的。
Some people say, I'm going to vote because of a person's political party. Some people say, I'm going to vote because this person will lower taxes. Some people say, I'm going to vote because this person will provide better health care.
有些人说我投票是因为他的政党，有些人投票是因为这个人能降低税收，有些人给他投票是因为他会提供更好的医疗保健。
But at the end, when it comes time to vote, some people just vote based on one factor. They'll say, well, I like this candidate better. So they'll ignore all of the promises or policies that they talk about and only vote on their persona.
但到最后投票的时候，有些人可能只是根据一个因素来投票，可能只是因为喜欢这个人，所以他们会忽视其他的因素，只是因为这个人的人格去投票。
So in psychology, this becomes important because the quality of our decisions are only as good as the weakest predictive variable we rely on.
所以在心理学上，这个点很重要，因为它决定了我们的决策质量。我们的决策质量一般依赖于最弱的预测变量。
Suppose I give a person many psychological tests, and each psychological test has several scores, and the scores point in different directions. Which one will I rely on?
那假如说我给一个人做一些心理测试，每一个心理测试都有一些分数，它们又分别指向不同的方向，那我要依赖哪一个呢？
So this becomes a complicating factor in how we choose the best form of therapy for people.
所以这就是我们在为患者选择最好的心理治疗时一个很复杂的因素。
I want to give you an example from the decision making when you get confused about variables.
那我接下来将举一个做决策的例子，当你感觉到对这些变量非常困惑。
A few years ago, I went out to buy a new automobile, and there were 3 automobile dealers near me that sold the same car.
很多年前我去买一辆新的车，我附近有3家经销商卖同样的车。
So I talked to one and got a good price. And then I went to another one and said, I've got a good price from your competitor. What will you offer me for a price?
那我和一家经销商去谈到了一个比较好的价格，然后我去其他人那边说，你的竞争对手已经给到我一个好的价钱了，你能出多少钱？
The only thing I cared about was price.
我只关注价钱。
But the dealer said to me, what color do you want? Do you need floor protectors? Do you want special paint on your car? He was trying to introduce extraneous variables unrelated to what I wanted to make my decision based on.
但经销商却对我说，你想要什么样的颜色？你需要地板保护器吗？你的车需要特殊的油漆吗？那他试图引入额外的变量， 来干扰我的决策。
Another way to approach the same problem is called the carpenter's bias. And what we mean by that is if you only own one tool and your tool is a hammer, then all the problems you have to solve with the one tool. Everything looks like a nail if all you have is a hammer.
那另一个相似的偏差是木匠偏差，意思是如果你唯一的工具是锤子，那你处理所有的问题，这些问题都看起来像钉子。
So if, for example, you train as a psychotherapist and you only train in one theoretical system or one set of techniques, like psychodynamic therapy, every patient you will approach from that one theoretical perspective.
如果你是心理治疗师，你只接受了一套理论的和技术的训练，比如说心理动力学，那你接触到的每一个病人都会试图从这个角度去理解他。
So going back to my example about the patient who comes in to see you and says that they're afraid of spiders, if you're a psychoanalyst, you might say, "Tell me about your mother."
所以让我们回到刚刚的例子，如果这个患者来到你的诊室说他害怕蜘蛛，如果你是精神分析学家，你可能会说让我们聊聊你的母亲吧。
And while talking about your upbringing and experiences you had as a child may help you understand why you're afraid of spiders, desensitization therapy is much more effective at reducing your fear of spiders.
那谈论你小时候的经历可能会帮助你理解你为什么会害怕蜘蛛。脱敏疗法其实会减少你对蜘蛛的恐惧，会更有效果。
So how do we select the best psychotherapeutic approach? One thing to think about is how long your knowledge stays current if you do no new learning.
那我们如何去选择最好的治疗方法呢？我们需要考虑的一件事是我们的知识能够维持多久。
Using the phrase that we have when we talk about radioactive decay, we talk about the half-life. How long does it take the radioactive element to become half as radioactive? Well, when you look at that with your education, if you study for a doctoral degree, 6 to 8 years later, half of what you knew is probably obsolete.
那我们可能会谈论到一个短语叫做放射性衰变，也就是半衰期。放射性元素要用多久会变成一半？那从我们受到的教育来看，如果你攻读了博士学位，6到8年之后，你的知识可能有一半就会过时。
So if we remain current and up to date on new research and new techniques, we have a better chance of avoiding biases and making good choices.
如果我们能够随时更新自己对新研究和新技术的了解，我们就能在做选择的时候更好的避免偏见，做出正确的选择。
This Venn diagram shows you how you can put it all together.
那这个表呢，显示出你如何把这些元素放在一起。
The red circle represents what the research tells us works best for the condition that the patient has.
这个红色的圈，意思是研究里面，告诉我们什么是最有效的。
The yellow circle represents the training that I have, the skill that I have, the techniques that I can use.
黄色的圈代表我拥有的训练、技能还有技术。
And the green circle represents what the patient would prefer.
绿色的圈代表患者更喜欢的方式。
And the red star in the middle is helping you to select the best treatment that fits all of those characteristics.
中间红色的星星，是帮助你选择符合所有这几个因素的疗法。
Earlier in the talk, I used the example of the patient who comes to see you and tells you that they're not getting along with their parents.
那之前我使用过的这个例子是说，有个患者来到这里说他跟父母相处的不好。
We know that there are different kinds of therapies that could work. We could suggest to the patient, how about family therapy, where we all get in the room together?
那我们知道有很多不同的疗法，我们可能会向他提议，我们不如做家庭治疗，让大家都来到这里。
But then the patient may say to you, oh no, I don't want that to happen. That will be too stressful.
但是患者说，我不想这样，这让我很有压力。
So maybe you want to try using problem-solving therapy or cognitive behavioral therapy so you can work with the patient alone to help them figure out a better way to work with their parents.
所以你可能会使用问题解决疗法或者认知疗法，这样你就可以单独和患者一起工作，去讨论他和父母相处的更好的方式。
And you know that even the best therapy won't work well if it's not acceptable to the patient.
你知道，如果这个疗法不适合患者的话，那它就不是最好的疗法。
I apologize for this very messy chart, but I will explain it.
不好意思，这一张表有点乱，但是我会逐一解释。
I use this chart to highlight the difference between qualitative research and quantitative research.
我通过这张表是想要去比较定性研究和定量研究的区别。
We know that quantitative research, which is on the right-hand side of the screen, often uses, we test hypotheses, we measure something and test it, we observe the results, and we like large samples that we can generalize to other situations.
对于定量研究来说，我们一般用它去检验假说，去测试和检验，我们去观察结果，观察大的样本，然后去推广到其他的情况。
On the other hand, we see on the left-hand side, we see qualitative research, where you're trying to discover ideas and create hypotheses, where you want to have more open-ended interviews, where you may have a very small sample that you're interviewing about a particular topic.
那在左边呢是定性研究，我们通过定性研究来发现一些想法，创造假设，然后我们会有更多的开放式的访谈，我们可能会采用小样本去采访一个特定的主题。
So to go back to my example about the person who's afraid of spiders, if we wanted to do quantitative research, we would want to find a large number of people who are afraid of spiders and give them various tests and try intervening with them and look at the results of these large groups of people.
那如果我们回到刚刚的害怕蜘蛛的案例，如果我们采用定量研究的方法，我们会给他们做各种各样的测试，尝试不同的干预，然后来看看他们的结果。
On the qualitative side, we might find a smaller number of people, some men, some women, some children, some adults, who all say that they're afraid of spiders, and interview them in a more open-ended fashion to ask them, tell me about your fear of spiders, and get more qualitative information.
那如果是定性的研究，我们可能会邀请一些男人、一些女人、一些孩子、一些成年人，他们都是害怕蜘蛛的人。我们会用一种更开放的方式去采访他们，邀请他们说一说对蜘蛛的恐惧，获得更多质性的信息。
Both types of data are helpful, but there's another type which can be more helpful. I've mentioned that on the left-hand side, and that's meta-analyses.
这两种方法都很有帮助。那我也提到了另一种很有帮助的方法，就是元分析。
So meta-analyses involves statistical analyses of large numbers of studies. So for example, we go to the scientific literature and find every published paper we could find that deals with the fear of spiders, and then try to summarize and integrate the findings.
那元分析涉及到对大量的研究的统计分析，比如说我们去查阅关于蜘蛛恐惧的研究，然后去总结和整合这些发现。
The point that I'm trying to make is that there are many different types of research which can help to guide our decision-making about which treatment to use.
所以现在我试图要讲的就是，我们有许多可以使用的方式，那去帮助我们决策哪一种疗法是比较好的。
This is an example of what's called a consort chart. This is the type of chart you would use if you were going to conduct a randomized clinical trial.
那这个是一个 consort chart 图表的例子。如果你要进行随机对照研究，就会用到这个图表。
This is the typical format you would use in a quantitative study.
那这是我们在定量研究中常用的典型的图表。
You can see at the top, they start with 132 patients, and then sort them into the patients who meet the criteria and the patients who don't. And as you'll see off to the side, 49 of the 132 patients didn't fit the criteria.
那我们可以看到顶部有132位被试，那他们会被分为符合研究标准和不符合入组标准的。那最后有49名被试不符合入组标准，被排除在外。
So the 83 people who were left were sorted into 3 groups. One group got treatment as usual, the normal treatment for this particular study, which was a diabetes study.
那这83名参与者会被分成3组，一组是接受常规的治疗那这个研究中是针对糖尿病患者的常规治疗。
Another group of patients got an 8-week intervention, and the third group got a 16-week intervention.
那另一组的患者接受8周的干预第三组的患者接受16周的干预。
So at the end of the study, you can compare 3 groups of people, one who got usual treatment, one who got a slightly different treatment, and one who got a very different treatment.
所以在研究的最后，我们可以比较3组的被试，那一组是采用常规的研究，另一组是采用有一点不同的研究，最后一组是采用非常不一样的治疗方案。
This is one of the most rigorous types of studies, but they are hard to do because they are time-consuming and require a lot of resources and monitoring to carry them out.
那这是一种比较严谨的研究方法，但是也很难做，因为它很花时间，也需要大量的资源和监控。
So I have talked to you about making good choices for therapeutic techniques. I also want to mention the importance of, just like we have evidence-based treatments, we have evidence-based relationships.
那我们刚刚谈论的是选择心理治疗方法的决定过程。那接下来我要谈论一下循证的关系。那就像我们有循证的治疗一样，我们也有循证的治疗关系。
These are different ways that therapists can approach, or different aspects of a therapist that can influence the outcome of treatment.
那治疗师和这个来访不同的关系、不同的接触方式是可以影响治疗结果的。
The first one is the idea of a therapeutic alliance, meaning that the patient and the therapist are working together in an alliance to treat the patient's problem.
那第一个是治疗联盟，就是病人和治疗师在一个联盟中一起工作来治疗患者的问题。
Another aspect of psychotherapy that is very important for a good outcome is the therapist's empathy. And by this, I mean, can the therapist show emotional support to the patient?
那心理治疗中另一个很重要的方面是治疗师的共情。那通过共情，治疗师能对患者表现出情感上的支持。
Another approach, which was originated by Carl Rogers with his client-centered therapy, is the importance of positive regard.
那另一个方式呢，是来自于卡尔罗杰斯，就是以来访为中心的治疗，其中积极关注非常重要。
The best way to explain this is, can I, as the therapist, have positive feelings toward my client and demonstrate those?
那其中一个解释这个方面的好方式是，我对我的来访有积极的感觉吗？
If you really do not like the client or the patient, you probably will not be able to help them. They probably will sense that you dislike them, and you may not invest the same energy in them that you would in another patient.
那如果你真的不喜欢这位患者，你也很难去帮助他们，他们可能会感受到你对他的不喜欢，你也可能不会像对待其他患者一样对他投入同样的精力。
Genuineness, which you might also say sincerity, or being accurate and open in your relationship with your client, can also be important.
那真诚，或者说在你们的关系中保持开放和真实也是非常重要的。
Another aspect that is very important are your client's expectations. If you approach your client with a positive attitude and help them to believe that you can help them have a positive change, and they expect a positive change, that's more likely to be effective than if you're pessimistic or quiet about outcome.
那还有一点是来访对结果的期望。如果你对待一个来访非常积极，并且让他们相信会有好的治疗结果，那这比你对治疗结果保持悲观会更有效。
So what I'm trying to say on this slide is that the way you approach your client and the relationship you establish is probably equally as important as the technique or theory that you're using.
所以我 这张 PPT 上要说的就是你和来访的关系，和你使用的技巧或理论同样重要。
I'm giving you an example of comparing some evidence-based treatment with some discredited treatments.
那接下来我会举一些循证治疗的例子和不可信治疗的例子。
One of my areas of research is looking at discredited treatments that don't work, but that some people try to use in therapy.
那我的一个研究领域就是研究一些不可信的治疗方法，这些方法不好用，但是有些人仍然试图在治疗中采用它。
I refer to those as psychoquackery.
那我有时候称他们叫变态骗术。
So some examples of therapy that have a good evidence base to show that they can work with different populations include acceptance and commitment therapy, medications that have gone through pharmaceutical review, cognitive behavioral therapy, dialectical behavior therapy, exposure therapies, different forms of family therapy, interpersonal psychotherapy, and motivational interviewing, all different techniques.
那有一些治疗方法有很好的证据基础，也研究发现这些方法能够治疗不同的患者，包括接纳与承诺疗法，还有一些已批准的药物、认知行为疗法、辩证行为疗法、暴露疗法、功能性家庭治疗、人际心理治疗和动机式访谈。
On the discredited side, there are people who, at least in the United States, practice angel therapy. If they'll say you can pray to an angel to help you with your mental health. There are people who practice aromatherapy. They say fragrances can help enhance your mental health.
那至少在美国，有些人会使用一些不可信的方法，比如说天使疗法。他们会说，如果你向天使祷告的话，可以帮助你增强心理健康。或者有人认为这个香气可以起到疗愈心理的作用。
Some psychotherapists claim that you have an aura or life force energy that they can manipulate by hand gestures or using crystals.
那有些心理治疗师会声称你有一种气场或者是生命的能量，他们可以通过手势或者水晶来操控这个部分。
You see some other ones listed here, but my two favorites are past life regression therapy and rebirthing therapy.
那你可以看到另外一些我最喜欢讲的两个方法，叫做前世回归疗法和重生术。
In past life therapy, the therapist will tell you that your mental health problems in the present time are all related to who you were in a previous life.
那前世回溯疗法会声称你现在的心理问题是根据你与你前世的身份有关。
They will attempt to help you imagine who you were in your previous lifetime so that you can overcome the stresses you experienced in your past life.
那他们就会试图帮助你去想象你在前世是什么样子的，这样你就能够克服前世所带来的压力。
In the rebirthing therapy, the theory was that if you take a person and wrap them up tightly in a blanket and force them to free themselves, that's like coming out of the womb and being born again.
那在重生术中，他会把来访紧紧地裹在毯子里，然后强迫他们去 向外释放自己，就像从子宫里走出来获得重生一样。
We actually had a case in the United States where a child died during a therapy session.
那在美国，我们其实知道有一个案例是孩子在这个重生术中去世了。
The psychotherapist, not a psychologist, had the child tightly wrapped up and telling the child to escape from the blankets and had the parents holding the child down. The idea was that the child, by being reborn, would have a better relationship with her parents, but she suffocated.
那这个心理治疗师，而不是心理学家，他把孩子紧紧的包裹起来，然后让孩子从毯子里逃出来，想让父母把孩子抱下来。他们的考虑是，孩子重生之后就会和父母有更好的关系，但是孩子窒息了。
The psychotherapist went to prison for manslaughter, and the state in which this happened was the state of Colorado, passed a law against rebirthing therapy.
那这个心理医生最后因为过失杀人罪而入狱。那发生了这种情况的科罗拉多州通过了一个律法，就是禁止使用重生术。
It's somewhat ironic that they felt the need to pass a law against this because no one recognizes that, except for the person who was doing it at that time, no one recognizes this as a valid or effective therapeutic technique.
那有一些讽刺的是，他们觉得需要通过法律来禁止这样的行为。因为除了当时做这个事情的人，没有人承认这一点，没有人认识到这是一种没有效果的治疗方法。
My purpose in giving you these contrasting examples is to show that some people have biases about some forms of therapy that are uniquely appealing to them and persist in advocating for those forms of therapy, even though there's no evidence that they work.
那我举这些有很强对比作用的例子，是为了说明有些人就是有这样的偏差，他们会对具有独特吸引力的疗法有非常强的相信。他会认为这些方法即使没有证据证明它们有效，依然会坚持这种形式的治疗。
I wanted to give you some resources of where you could find more information on evidence-based practice. And I've given you both the names of the creators and the websites where you can find them.
那我接下来将会给大家一些相关的资源，你可以在这里找到循证治疗的信息，然后我将会给到这个资源的名字。
The ones that I found most useful are actually the American Psychological Association practice guidelines.
那我觉得其中最有帮助的是美国心理学会临床实践指南。
They have some specific population-based guidelines.
他们有针对具体人群的治疗方案的指南。
For example, treatment with psychotherapy with women, psychotherapy with older adults, psychotherapy with trauma victims.
比如说，针对女性的心理治疗，或者针对老年人的心理治疗，或者针对创伤受害者的心理治疗。
And those guidelines give you practical advice and also cite the most recent research.
那这些指南会给到你一些实践的建议，而且会引用最新的研究。
I'm also giving you some information on some studies that I've done, especially with my colleague John Norcross, where we looked at some discredited psychological techniques and we talk about how to make choices on evidence-based practice.
那这是关于我的一些研究，尤其是和我的同事 Norcross， 让我们做过关于这些不可信的心理治疗的研究，以及关于我们如何在心理治疗中做出最佳疗法的选择的这本书。
So I made copies of this PowerPoint available, and you can get the PowerPoint and all the slides from the association. But I also wanted to take time to answer questions that you might have.
那我的这个 PPT 大家可以从协会这边去获得。那接下来我们留点时间给大家提问。
Don't be shy.
好的，非常感谢库切尔教授。看看各位老师，有没有什么问题？欢迎老师们打开摄像头哈，这样的话我们有一个更好的那个感觉哈，跟库切尔老师来对话。大家可以先介绍一下自己哈，这个。瑞林可以简要的翻译一下，我觉得。
Thank you very much, Dr. Koocher, and welcome everyone to raise any question and open your camera. And before you raise your question, please introduce yourself.
I would welcome hearing from you about anything that I had to say or about any issues that you think are important related to psychotherapy, good psychotherapy practice.
那希望大家多多提问，关于这个心理治疗如何选择比较有效的心理治疗方法。
有提问的老师别忘了打开摄像头啊，打开那个麦克风。
好。我想问库舍博士一个问题，就是我刚刚看到您提到了循证疗法，也提到了循证，就在我印象中，好像在美国，好像大家也会经常会出现支持其中一方，强调其中一方，然后好像也会存在一些的割裂感，然后我不知道是不是这样的情况，以及您怎么看待这样的情况？
您是说支持其中一种流派、一种方法是吗？
不是，是要么是支持循证evidence-based treatments， 或者是 evidence-based relationships。
Yeah, Dr. Yan asked in American, I heard that some people support the evidence-based treatment and some people support evidence relationship, right? And how do you, what's your opinion on this?
Well, I think both are important. I think unless you can have a good relationship with your patient, it's hard to get them to follow your advice. One of my areas of research has been in medical non-adherence, people who don't follow advice.
那我认为这两者都是很重要的，因为你要和病人去建立好的关系，这样他们才会听从你的建议。我的一个研究领域之一就是研究那些不太遵循医学建议的人。
If people think that their physician, their medical doctor, likes them and cares about them, they are more likely to follow the doctor's advice than if they dislike the doctor.
那如果这个患者认为他们的医生喜欢他，他就会更多的听从这个医生的建议。
So if we want patients to take our advice home with them and practice what we talk with them about, we'll be more effective if we have a good relationship with them. It's not enough to know it here, you have to know it here too.
那如果我们想要让病人接受我们的建议，我们就需要跟他们建立良好的关系，这样我们的治疗才会更有效。
Thank you.
Actually, I have a small question. First, I want to thank you your very interesting speech. And earlier you mentioned that if you don't like your patient, then it will affect the efficacy of your therapy. Then I want to know that is there any, scale to measure the dislikability of your patient, and what's the cutoff?
It's there's a couple of different cutoffs. One cutoff is if you feel so negatively about a person, refer them to another practitioner, send them to someone else. Just using myself as an example, I'm a pediatric psychologist. Most of my work is with children and families affected by serious illness. So to use my old example, if someone came looking to have help with the spider phobia, I would send them to someone else.
Because you are afraid of spiders.
No, I just don't. I prefer a different group to work with. At the same time, there are some groups that I would not want to work with. For example, predatory child molesters.
Ah, I see.
It would be very hard for me to like or to feel good about such a patient. So I would send them to someone else.
Okay. So is the cutoff is very subjective.
Yes, it is very subjective in terms of what is your skill set and what are your preferences. And remember, at least in the United States, you don't have to treat everyone that calls you for an appointment. You can say, I'm sorry, I don't work with this population, or someone else would do better with you.
I see. Thank you. Thank you for your answer.
I will translate that. 就是我也翻译一下。岸本彭子老师问，就是老师刚刚提到，我们对一些患者可能不太喜欢，那会影响疗效。那我们应该怎么做？有没有一些界限，有一些边界？那 Koocher 教授说，我们可以把它转介给其他的心理治疗师。那比如说，我就不会和有蜘蛛恐惧症的人一起工作，我更多是和儿童或者是有重症的儿童一起工作。就是我们不需要去接待每一个预约我们心理咨询的来访，我们可以告诉他我可能别人跟你一起工作会更好。
谢谢库克老师啊，我想提两个小问题。第一个就是那个我记得库克老师是做那个这个有害的或者这个 harmful 的那个无效的那种心理治疗的一些研究。我在想问一问，就是美国现在在社会上做这种无效的以这个就是被证明有害的这些心理治疗的这个治疗师还有没有，这个比例高不高？第二个的话就是这个循证的这样一个心理治疗这种理念，在大学的这个教学的这个过程中间，它现在是大概的这个流行的这个或者普及的一个程度是什么样子的？我们想请教这个库克教授。
Dr. Koocher, Dr. Yang has two questions. The first one is, how many therapists in America still doing the harmful psychotherapy? You want to know the ratio. And another question is, the evidence-based psychotherapy is popular in America, and what's the popularity in America?
And the first question was about psychoanalysis. Was that
Harmful psychoanalysis.
harmful?
Yeah, the discredited.
Oh, discredited. Well, the problem is how no one studies the numbers, but there are websites in the United States that you could go to find people offering these therapies. The best way to think about it is when you have a condition that's difficult to treat and you have a charismatic expert saying, I have a good solution that will help you, many people believe that.
那就是对于这种有害的心理治疗呢，我们并没有准确的研究数字，但是你可以在一些网站上去找到从事这些疗法的人。那而且有一种情况就是，当你有一个难以解决的、难以治疗的问题时，如果有一个专家很有魅力的专家说，我有一个好的办法可以帮到你，那很多人就会相信。
The attention to evidence-based practice is very popular, and among licensed psychologists, it is expected that you will be able to justify your practice. Meaning, if somebody criticizes you for what you're doing, you should be able to produce proof that this has worked for people.
那对循证治疗在美国是很普遍的，尤其是在有执照的心理学家中，人们会希望你能够证明你的做法、你的疗法是正确的、有效的。也就是说，如果有人批评你所做的这种方法，你应该能够拿出证据来证明它是有效的。
Very often, the people who are practicing the discredited therapies are not licensed.
那很多使用不可靠的疗法的治疗师，很多是没有执照的。
In the United States, if I want to call myself a psychologist, I must have a license from the state. But if I call myself a psychotherapist or a counselor, I don't need a license. That is not a regulated term.
在美国，如果我称自己为心理学家，就需要有州政府的一个认证。那如果我称自己为心理治疗师或者心理咨询师，我就不需要相关的执照。它不是一个很规范的称呼。
One of the words I hate is holistic therapy.
我很不喜欢的一个词就是整合式心理治疗。
When you hear people saying they do holistic therapy, that means that they're doing something that has no evidence base. They'll burn incense, they'll adjust your aura with magnets, but it's not regulated.
如果说有人说他们在做这种整体的心理疗法，就是意味着他们在做一些没有证据的事情，然后也没有监管。
好的，谢谢。
好，那我接着杨老师来请教Koocher教授。实际上呢，我觉得在我们国家，现在这个循证在这个临床这咨询和治疗中间，这个循证的意识啊，这个没有那么的普遍。 不像美国哈有这么普遍。当然我很想了解一下，比如说现在从这个比如说美国的 APA 或者29分会对未来的这个美国怎么样更好的推进这个循证治疗有什么样的规划因为实际上呢，就像刚才库切尔老师介绍的，其实治疗师或者说咨询师在他的实际工作中间，其实他经常还会是按照自己的这种兴趣取向，不太愿意去学习这个新的东西哈，这是一个就是人本身的一个特点。所以呢，就是实际上在怎么样更好的推进这个方面，我不知道就美国有没有什么规划哈。对，我想对，请库切尔老师简要介绍一下。
Dr. Liu has a question. In China, we a lack of the awareness of evidence-based practice, and it's not so common in China. And he wants to know in America, especially in APA or the 29 division, do you have any plan to advance this approach in America in the future? And do you have any plan? Because in the real practice, the therapist or the psychologist always inclined to do the therapy in their own, from their own interests instead of the evidence. So how to suggest more people to do the evidence-based therapy?
You know, that question reminds me of the story I told you about the Japanese psychologists after World War II.
那这个问题也让我想到刚刚讲的二战后日本心理学家的故事。
For many years, they looked only at psychoanalytic therapy.
那很多年来，他们都只是使用心理动力精神分析的疗法。
But as the culture opened up and as more scientific journals were able to get into the country, and as people were able to read and go to scientific meetings and learn about new techniques, interest in broader techniques came forward.
那随着文化的开放，有更多的期刊科学的研究进入到国家，人们能够去参加学术会议，科学的会议，学习新的技术，然后对更为广泛的技术产生兴趣。
Many people, practitioners in the United States would call themselves eclectic, meaning that they blend many techniques. I graduated with my doctorate in 1972, and the two most prominent theories at that time were psychodynamic and Rogerian.
那很多美国的心理学从业者会称自己是折中或者整合，就意味着他们是融合了很多的技术的。我1972年博士毕业的时候，最流行的两个理论是心理动力学和另一个是没太听清是
以人为中心
的罗杰斯的理论。
But as a licensed psychologist, I'm required to renew my license to take continuing education courses every year. And over the years, I've learned new techniques. And so while I still understand the psychotherapeutic theory underlying psychoanalysis and Rogerian therapy, I've also learned to apply many other techniques as well.
那为了延续我的这个职业的执照，我每年都需要参加继续教育的课程，所以这些年我也学到很多新的技术。那虽然我仍然理解和使用精神分析和就是罗杰斯以人为中心的疗法，我也学会了很多其他的技术。
So when I work with a patient, I think of that Venn diagram I showed you, I think about the different techniques I know and what will work best for this patient and for their symptoms.
所以当我和患者一起工作的时候，就像我刚刚展示的那个3个圈的图一样，我会根据患者的情况、症状，还有我掌握的技术来去选择。
I would ask, what is the most popular psychotherapeutic theory in China? What are the most popular approaches used in China?
我想问一下，现在在中国最为流行的流派？
在中国呢，据我所知哈，其他各位老师补充哈，那最流行的也是这个动力学的，当然呢还有 CBT 的，对，但是呢，我觉得都是基本理论。现在像就是单纯的，比如说针对这个，像比如说针对边缘人格障碍的 DBT， 还有强迫症的 ERP，像这些就是 evidence-based treatment 呢，就现在刚刚开始，就开始有组织在培训了。但是总体上来讲呢，就是还是动力学 CBT 的基本理论为主。
Dr. Liu said now the most popular approach is psychodynamic and the CBT. But the approach is very basic, and people learn the basic theories of this approach. The approach, such as the DBT for personality disorders, is still a start, and the approach for the specific disorder is not very popular in China.
I will tell you a funny story because it's very important in the United States for people to understand different cultural groups.
那我想跟大家分享一个有趣的故事，就是在美国，人们要去理解不同的文化群体。
I was doing one of my specialties is working with families that have lost a child.
我要和一些失去孩子的家庭一起工作。
I was working with a family whose college-age daughter had been murdered.
有一个家庭，他们正在上大学的女儿被谋杀了。
The family had a mother, father, and 3 adult children who were survivors.
那这个家庭中的母亲、父亲和3个成年的和3个孩子是幸存者。
There was a lot of disagreement in the family about whether they should travel across the country to sit in the courtroom where the daughter's murderer was on trial.
他们有很多的分歧，就是当他们在女儿的谋杀女儿的凶手受审的法庭上，他们产生了很多的分歧。
So I was the therapist trying to get the family members to talk to each other.
我是其中和他们每个人去沟通的心理医生。
Mother and father were immigrants from China.
这个父母都是从中国移民过去的。
They were in their 60s.
他们现在是60多岁。
Father was a famous professor at MIT.
这个父亲是 MIT 的很有名的教授。
The 3 adult children were all very successful in their professions, and one was a psychiatrist.
那这3个成年的子女都非常的优秀，其中有一个人是精神病学家。
So I had them in the therapy room, but the only one who was talking was their father, the professor.
我跟他们一起在治疗室里面沟通，其中只有父亲在说话。
I suddenly realized that I was dealing with a different culture from normal American families.
我突然意识到我正在和一种很不同的文化，不同于美国普通家庭的文化进行沟通。
So I said to the father, Professor, how do you feel about your family talking too? Also.
那我对父亲说，教授，你介意让你的其他家庭成员也说话吗？
And then he said, yes, yes. And then everybody began to talk.
然后他说可以，然后其他家庭成员才开始说话。
But it required permission of the senior elder father before the children would start to speak in front of their parents.
所以看起来只有长辈这个父亲发话，其他的孩子才敢说话。
Very different from an American family where the children would be yelling at their parents from the beginning.
这和美国家庭很不一样，可能在美国家庭，孩子们从开始就已经在父亲面前大喊大叫了。
I just use this example to illustrate how important it is for you to understand the culture and preferences of the people that you're working with. They may be very different from your own.
我就想用这个例子来说明，去理解你的来访的文化背景是很重要的，它可能和你自己的背景非常不一样。
I am teaching a course at Boston University in psychotherapy for graduate students. And one of my students is from China.
我在波士顿大学给大学生上这个心理治疗的课，其中有一个学生来自中国。
And she told me about being a left behind daughter.
她说她是一个留守的儿童女儿。
Which was, it was a very sad life experience for her, but not something that we would know about in the United States unless she was able to talk about it.
这是一段非常悲惨的人生经历。那如果她不去说这件事儿的话，我们可能就不知道。
She had a brother, and so the family moved to the city for him to get a better education, but left her back in the countryside.
那他的家人还有他的哥哥，就是为了让他的哥哥或者是弟弟接受更好的教育，全家就搬到了城市里，把他留在了乡下。
I think that experience helped her to want to be a psychologist.
那我认为可能是这段经历让他想要成为一名心理学家。
这个自助式的，就用手机包括网络来进行这种干预的这种潮流越来越大，我就想问一下，这样的干预，它在于循证治疗当中的一个位置，这是第一个。另外一个就是我想问一下，如果我们想要去开发或者是给别人介绍这样的程序我们需要注意什么？还有一个问题就是我想问一下这个 AI 在现在的心理咨询当中的位置和未来的前景，比如说这个 ChatGPT 的作用。
Okay. She has 3 questions. First one is the self-help intervention using mobile phone is a trend now. So he wants to ask, what's the role of the self-help intervention in the evidence-based psychotherapy? And maybe we can one by one.
So we're doing one at a time. So self-help resources are very important for 2 reasons. One is some people do not want to go to see a psychotherapist, but they could use a book to help them. Also, many psychotherapists will use self-help books in addition to their verbal psychotherapy to help a patient get a different perspective.
那就是有一些人可能不想去看治疗师，他们就可以用自助的书籍来自助。然后一些心理治疗师除了进行这个谈话的治疗外，还会也用自助书籍来帮助病人去了解更多的观点。
One problem with self-help books is when the patient misdiagnoses themselves.
但有一个问题就是使用这种自助的书籍，就是我们病人可能会误诊自己。
Suppose you have a paranoid schizophrenic patient who decides that their problem is low self-esteem. So they decide that instead of taking medication, they're going to go get a self-help book on how to improve their self-esteem.
那假如说有一个偏执的精神分裂的病人，他们觉得自己的问题是自尊心比较低，那他们决定不吃药，而是去看一本关于如何提高自尊的自助的书籍。
Their bad choice will not help.
那这个就是一个不太有帮助的选择。
Did he have two other questions?
Yeah, another second question is, how do we? Sorry， 第二个问题是我们怎么去开发还是推进这样的？
因为我现在在开发一个就是用手机自助的一个干预方案。就是我想问我们在这个过程中需要注意什么？然后或者说别人选择这个自助式的我说的其实是网络干预的这种方案的话，它需要注意什么？
就是Dr. Xu is developing a self-help intervention using the mobile phone, and he wants to ask the clients, if the clients choose this kind of intervention, what should they pay attention? Yeah.
There's a significant growth in the use of mobile health apps for mental health purposes. My favorite is a way of tracking your patients in between sessions, where you can ask them to rate their symptoms during the week in between your visits. And so when they come to see you, you can see what their ratings were on depression or anxiety during the week.
那这种手机干预的程序，现在 APP 现在非常的流行。那我很喜欢的方式是在治疗的间隙，让病人使用这样的程序来记录他们对焦虑或者抑郁的评分，这样你下次治疗的时候就可以看到他们在这一周内的变化。
There are also some research that I know of using cell phones to send positive messages to clients in between sessions, especially depressed clients.
那我还知道有一些方法是用手机在治疗间隙向患者发送一些积极的信息、积极的内容，尤其是对于一些抑郁的患者。
One big worry in the United States is privacy, and who will know about what you're saying on your cell phone?
那其中有一个很大的问题，尤其是在美国，就是隐私的问题。那我们并不知道你在这个手机上的信息会给到谁。Okay, and the third question is about how do you think of the GPT? ChatGPT is kind of AI psychotherapy. Their role in the development of psychotherapy.
So I think that in the near future, we will see people trying to create artificial therapists. There is a website.
Okay.
I put it in the chat, Replica, spelled with a K, where you can create an avatar who will be your friend.
就是有一个，就是这种，首先库切教授说，在不久的未来，人们可能会尝试用人工，就是 AI 的心理治疗师去做心理治疗。现在有一个软件叫 Replica 发在聊天框里了，就是我们可以创建一个虚拟的形象，把它当做你的朋友。
And if they connect Replica to the AI programs, you may have an artificial therapist who can interact with you. How successful will that be remains to be seen.
那如果我们把这样的软件和 AI 去进行结合，你就拥有了一个虚拟的心理治疗师。那这样的方法未来有什么样的前景？我们拭目以待。
好的，各位老师，这个我刚刚在聊天框里打了一下留言哈，就是严老师跟我提醒我，原来跟Koocher 教授约的是这个1个半小时啊，我以为是2个小时啊，所以时间应该是到了啊。那么这个我觉得也感谢大家参与啊。那么我想呢，再跟Koocher老师介绍一下，实际上呢，我们的这个循证心理实践的这个小组，实际上是我们中国心理学界的第1个循证心理小组我们的目标就是要推进中国的循证心理实践的这个发展。那么今天呢，我们是去年11月份开始的第1次活动今天呢是我们的第2次活动，所以呢，我相信库克尔教授今天的讲座以及与我们的交流会给我们非常多的启发，会对我们推进这个工作会非常有帮助。所以呢，在这里要特别感谢库克尔教授以及包括29分会对我们对我们中国的循证心理治疗发展的这个支持那你翻译一下吧。
So Dr. Liu said he realized that we have an appointment for 1.5 hours, so maybe it's time to stop here. And Dr. Liu also expressed his thank you to Dr. Koocher. He said our evidence-based program group is the first group in China, in China's psychological field. So our goal is to promote the development of evidence-based psychotherapy in China. So we have our first activity in November last year, and today is our second activity. So I believe that Dr. Koocher's lecture and communication gave us many inspiration, and thank you very much for Dr. Koocher.
Thank you for inviting me. I'm delighted that you invited me. It's a pleasure.
Thank you so much. 好的，那再次感谢大家。那我们今天要不然就到这里。好的，谢谢。Thank you so much. Thank you all. Bye bye.
Thanks, Dr. Koocher. Bye bye.